You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning, everyone. Now, this is IBS Part 2. I think I'm going to do a couple other little health things this morning. Okay. Let's continue on with IBS. Now, yesterday we looked at the symptoms, okay, IBS. And again, when a doctor gives you a diagnosis of IBS, it's usually because they can't find anything. Because, again, what doctors ordinarily are looking for, you got digestive issues, they're looking for pathology. They're looking for ulcerative colitis, they're looking for... You know, if they do a scope, they're looking for diverticulosis. They're going to make sure they eliminate Crohn's and there's another one, IBD, which is irritable bowel disease, which is actually a disease. But we're talking more about IBS, which is a syndrome, and the symptoms are very similar, okay? Problem is, when you usually get into something more pathology, you're getting... ordinarily chronic diarrhea, like just diarrhea, like, you know, if you have ulcerative colitis or whatever, you're on the toilet, 15, 20 times, even in the morning. It's so disabling. And a lot of people suffer from that. And I'm not minimizing that. And that, is something that usually progresses from IBS. So we're talking about IBS. So that's bloating and gas, and maybe diarrhea, constipation, or both, right? And a fluctuation between diarrhea, constipation. We talked about that, difficulty in even energy. Well, you can imagine, if your gut's not good, you don't feel good, right? I mean, it drains you. And so, and maybe a change in the stool with mucus in the stool or whatever. So those are all things. And then yesterday we talked about the causes of that. Okay, what can cause IBS? And we talked about the overuse of antibiotics because we see so much Candida albicans, which is a big problem. Number one problem, we talked about SIBO or SIFO. One is bacterial, the one is fungus. And I believe that anything in the small intestine is fungus related. It's yeast, much more than it is bacteria. Now, bacteria can happen. Usually bacteria, though, when it does happen, it happens in the stomach. Okay, like H. pylori. You've heard of that. H. pylori happens mostly in the stomach. So it's the upper GI, stomach. And you can get acid reflux from H. pylori and stomach problems. But I'm talking more about IBS and gut, and that's more fungus. That's a yeast infection. We talked about that yesterday. Poor stomach acidity, and some people are confused by that. Okay, let me just go over that for a second again. Some people are confused about low stomach acidity because they got acid reflux. Doc, I got acid reflux. So my stomach, I'm making too much acid. Well, yes and no. Yes, now you're making too much acid. The proton pumps, you got little pumps inside your stomach. You know what they release? Acid. Your stomach is supposed to be very acidic. If it's not acidic enough, that's when you get acid reflux. Acid reflux doesn't come first. It comes because you don't have enough acidity in your stomach. And then your body produces more, it overcompensates, and you get acid reflux, which is terrible. One of the things that drive people crazy is acid reflux. And a lot of people, and then they find what they call a solution to it. They take medication from Nexium to Prilosec. Some of them are over the counter, and they live on Rolaids or Tums or over the counter medication. But guys, that is just masking the problem. It's not fixing the problem. It's masking the problem, okay? And that, guys, you got to just understand, okay? So if it's upper GI, like more of the stomach, that can be bacterial. Okay? People that get C. difficile in the hospital, that can attack their stomach. You can become very sick with that. But one of the common ones is a bacteria that sort of lives around your stomach, and it'll never bother you if you have enough acidity in your stomach. It's called H. pylori. Okay? And there's a test for that. And, again, I'm not too worried about H. pylori if you have good acidity in your stomach. So, that's why, you need that. And that's a big part of your digestive tract. So it can start with problems there. Now, another thing that we talked about yesterday was diverticulosis, pouches. And we talked about one of the reasons, the main reasons we're seeing it so much more today is because of the amount of fiber in the diet. Because people sort of bought the idea that without fiber, I'm not going to go to the washroom, and therefore, and people live on fiber today. And I'm not saying fiber isn't any good. What I'm saying is it's overrated. Because if you got any kind of digestive issue, fiber will just irritate the stuffing out of your gut. So be careful with that. And I find that when I get patients off fiber completely, that's why the reset, one of the benefits of the reset is you're hardly eating any fiber at all. And what that does is it gives your gut a rest. I always talk about what the reset does is it gives your pancreas, maybe you've heard me say this, I'm sending your pancreas to Hawaii on a holiday. Okay? Because for 30 days, you're hardly going to secrete any insulin at all. It's meant to fix metabolic syndrome. It's meant to fix your blood sugars. The other organ that really benefits is your liver. Okay, so we talked about that. It empties out your liver. It detoxes the liver. Because one of the things in your liver that holds on to toxins the most is fat in the liver. Fat in the liver holds on to mercury. Fat in the liver holds on to heavy metals like cadmium and lead and all these things. So fat does not belong in the liver, okay? And you don't get fatty liver, guys, by eating fat. You know that. I repeat that, but you know that. And I'm just telling you again and again and again. You don't get fatty liver from fat. You get it from carbohydrates and sugars, especially high fructose corn syrup, which is the sugar made by man. High fructose corn syrup is not found in nature. It's not. It sounds good. High fructose, fruit sugar, corn, dog, that's got to be good for you. Sugar. High fructose corn syrup is made in the laboratory, brought to you by the food industry. Okay? So high fructose corn syrup, what it does, it doesn't go through your gut. It goes to your liver, and your liver gets it, and it's rapidly turned into fat. And this is why you see even kids who drink those juice boxes, who live on pizza and crappy dinner and this kind of all carbohydrates, and all their sugar is about 200 pounds of sugar a year and 200 pounds of high fructose corn syrup a year. It's in everything. It's the sugar, and they hide it with a pile of names. You read your labels and, it's sucrose, it's this, it's that, it's everything else. No, it's high fructose corn syrup. You know why they use it? Because it's cheap. It's addictive. Anyway, and that feeds yeast like you would not believe, that sugar. Yeast love high fructose corn syrup. And that's why you get so many people with digestive issues. Anyways, on the reset, we're fixing your pancreas. We're regenerating the pancreas because we're sending insulin on a holiday. Your pancreas is going to Hawaii. The only thing that can travel today, right? We can't travel. I feel sorry for the airline industries. I mean, you think of what's happening in our world. And I just read it this morning about an airline going into receivership. Well, no wonder Nobody can travel, but you can send your pancreas on a holiday. You can send your liver on a holiday. It will empty itself out, clean up all the toxins in it. That will lower your triglycerides, elevate your HDL, the very things you need for your heart. Lower the triglycerides, elevate your HDL, clean out all the toxins. You know, people ask me, Doc, how can I detox? Well, you don't have to do anything specific other than change your diet. That's how you detox your liver. Your liver is 100% reliant on what you eat. And you want to get rid of all that glycogen and all that fat that surrounds your liver and is inside your liver. Then your liver, you guys, you can't live without your liver. You know what one of the most deadliest cancers is today? And in an epidemic proportion? Liver cancer. Liver cancer. And pancreatitis. And pancreatic. You know, pancreatic cancer at one time was unbelievable in terms of how little you would see pancreatic cancer. Even in the 60s and 70s, when I started practice in the 70s, pancreatic cancer, when you got it, it was deadly. But people didn't die of pancreatic cancer. Today, it's unbelievable. And guys, you don't have to go very far. You just have to start thinking about where it comes from. It's the change in our diets. It's the fact that we're carboholics today. Okay? We're carboholics today. So, anywho, okay? So that's very, very important. Now, the other thing that I want to talk to you about is you can heal your gut. Okay? So we talked about the symptoms. We talked about the causes of IBS. Okay? And we talked about stress yesterday. We talked about food intolerances. Find out. Don't, in my opinion, don't spend money, guys, on getting what am I intolerant to? You do it. Do the elimination test. You do it. Now let's talk about fixing. The best thing that you can do for your gut, and I mean this, the best thing you can do for your gut in 30 days is do the reset. Do the reset. Because in your gut, you will have, if you do the reset, one thing, there's about 5 things that are going to help you. One, you are not going to have any fiber. No fiber in 30 days. Oh, Dr. Martin, how about I should be going to the bathroom every day, twice a day or whatever. No, that's when you're eating carbs. I'm not saying never go to the bathroom. Of course, I'm not saying that. Okay? All I'm saying is when you eat nutrient-dense food. You see, when I tell you about eggs, meat, and cheese, there's a reason I tell you that. They're so dense, nutrient-wise. It's just 100% nutrition. There's no waste. Think of what feces is. Feces is waste. And if you eat a lot of carbs, you will have a big stool. Okay? You will have isn't that wonderful? No, it's not wonderful. It's overrated. Because all I'm saying is your feces, what goes into the toilet, is waste. But when you're nutrient dense, every amino acid and all the vitamins and all the minerals and everything you need in your body is in those 3 groups of food. Eggs, meat, cheese. Eggs, meat, cheese. I want to talk to you about, remind me, okay? I'm going to talk to you about a new study that came out on dairy. I want to talk about that. I don't know if I'll do it today. But if I don't talk about it, remind me. Okay, so here's what gets a holiday on the reset. Pancreas, your liver, and your gut. Your gut takes a holiday, okay? And for those who suffer from upper GI, that acid reflux, you know what acid reflux is, by the way, guys? The 99% of acid reflux is your body screaming at you, hello, you there, you're eating too many carbs. It's amazing when people cut their carbs how their acid reflux goes down. It's amazing. It's almost 100% because it's to check the engine light on your body. When you're eating too many carbohydrates, you will get acid reflux. It kills the acidity in your stomach and your body has to make more. And it shoots it up your esophagus. Okay, so what gets a holiday? Your pancreas, your liver, and your gut. Because of the gut, it's nutrient dense. And now you'll have very little waste. So don't worry about it. You're not, I don't go, doc, I don't go to the washroom. Look, if you're feeling constipated and you're unwell on the reset, sometimes I got to give you some fiber capsules, okay? Just, everybody's a little different, but just the vast majority of people, thousands and thousands, have taken this route, a 30-day program to detox, and the results are astounding. I'll put them up against any other program. And I mean that. I'll put it up against any other. You name me the diet, I'll put mine up against yours or others at any time, and I'll show you the difference. Okay? And again, there's always a few exceptions. That's just the way human nature, we all got our own DNA. We got our own fingerprint. That's who we are. We're just, so the odd person, doc, I get constipated and it's bothering me. Okay, well, we'll fix that. Because I don't want you to come off the detox. It's so good for you. I don't want you to come off the 30-day reset. It's metabolically going to change your body. It'll get you off the Titanic. Okay? So, again, so what do we do? Okay, what do we do? Food we talked about. Do the reset. If you can, absolutely can. And it's not low carb, guys. The reset is not low carb. It's no carb. Nada. None. It's extreme, but it works. Now, what do I recommend? You got IBS. Well, you guys would, the first thing you would shout out is probiotics. Absolutely. You have to fix. There is not a chance that you would have probiotics. If you got IBS, you have leaky gut. 100%. Leaky gut is, remember what I tell you about leaky gut. Leaky gut is the battle between good and bad bacteria. Okay? It's a battle that goes on every day. You don't see it. It's an invisible war. Okay? They call the COVID-19 the invisible virus, which it is. But there is an invisible war going on in your body every day between good bacteria and bad bacteria. People don't realize that. People don't realize that. And the war primarily takes place in your gut. Okay? It also takes place in your brain. The war takes place in anywhere where you have mucus, but mostly it originates in the gut. When you get on a scale, take off 3 pounds. So when you tell me you didn't lose any weight, I said, well, wait a minute. -3. Because you got 3 pounds of bacteria. Yep, 3 pounds. Not billions of bacteria, trillions. But remember, you when you take an antibiotic, wipe out in 5 days. All your good bacteria are gone. And then you lose that war. You might not notice it right away because people think of leaky gut as IBS. Now, I've never seen a case of IBS without leaky gut. But there's some people that don't have digestive issues at all. And they have leaky gut. Because leaky gut can give you leaky skin. They think their gut is good, but they got bad skin. They got acne, or they have psoriasis or eczema, or like dermatitis or whatever. Anything you see on your skin, guys, that doesn't belong there, it's coming from your gut, the war in your gut. Leaky gut, leaky skin. Leaky gut, leaky brain. Okay? Remember what I've told you about MS? Autoimmune. That started in the gut. Parkinson's. It starts in the gut because it's yeast that gets up into the brain. How did it get up there? Because of this war that goes on. You're losing the war. And you might not have any gut symptoms, although a lot of people do, right? What are they saying now? 70, 80% of the population have some kind of digestive issue? Those statistics are astounding. It's very disabling, okay? So probiotics, absolutely. Get a broad spectrum probiotic and use it every day. I'm big on that. The Martin Clinic, we changed our mind. Tony and I talked about this last week. 5 years, 10 years, it's probably 10 years ago now. Because I used to tell my patients, now listen, I was one of the first people in the universe to talk about probiotics. In the 1970s. We didn't even know what they were, really. Well, we know about the microbiome now. But probiotics are so important because you know what? Even with chronic fatigue syndrome, I always found there was a connection. They always had leaky gut. Always. What came first, leaky gut or chronic fatigue? I don't know, but I'll tell you, That we're always connected. Anyway, so broad spectrum probiotic. What do I mean by broad spectrum probiotics? They have at least 10 different strains of bacteria. And I love the ones with L. reuteri and L. rhamnosus because those two bacterial strains are the strains that will help to get rid of your fungus, your yeast. L. reuteri, reuteri, and L. rhamnosus. I ain't spelling it for you. It's too long. But look for that. And you need broad spectrum. Broad spectrum means you have over 10 different strains of bacteria. Okay? 10 different strains of bacteria. And the reason is because different strains do different things. Okay? If you look at our probiotic, they're just broad spectrum, meaning they do different things. Some are destroyers, some are regenerators, some kill yeast, like I just told you. Some of them build your immune system. Different strains. They all have different Latin names, okay? I hate Latin. You? I hate Latin. I took Latin in high school. I hated it. You know? They told you if you go to medical school, you need Latin. Yeah. You got to memorize everything anyway. The names mean nothing. Like, what does acidophilus mean to you? I don't know. Right? Lactobacillus acidophilus. Big words just to keep you confused. Okay. Anyway, don't get me going. So, number one, probiotics. Number two, enzymes, digestive enzymes. Remember what we talked about earlier. In the stomach is where you want to start with your digest. You want that to be the furnace. And when you give your stomach, and especially as we get older, we don't make as many enzymes. It's important that we have lots of different enzymes. Amylase, protease, lipase, those are the ones that break down your food. And a lot of us need help to break our food down because our stomachs don't have enough acidity. Okay? You got any acid reflux? You're not having enough acidity. Make sure, okay, that you get enough acidity. I love broad spectrum. You know, by the way, you have broad spectrum probiotics and broad spectrum digestive enzymes. Okay? So those are two things I take every day. I take probiotics every day, every day, every day. I got a good gut, guys. Most people don't, but I do. I have a good gut. So far, so good, but I try and take good care of it. Okay? I want it to last. You don't even want to get me going on one of the most prolific and with the greatest leaps in cancer in terms of, I talked to you about pancreatic cancer, I talked to you about liver cancer. You know what one of the fastest growing cancers is in terms of the population? Bowel cancer. And more specifically, colorectal cancer. It is a terrible, terrible cancer that's affecting millions and millions of North Americans every year. And I tell you, it is fungal based. It is based on candida, leaky gut. It starts with the leaky gut. That's why I'm big on probiotics. I'm big on the digestive enzymes. Okay, you want to you remember yesterday we talked about one of the things, sleeping with the enemy, your pet. It's on your bed. I know you animal lovers. Okay, you know, your pet is here, and the rest of the world is down here. Right? I get it. I understand that. But people, listen. They're animals. Okay? And they carry parasites. And so do, by the way, fruits and vegetables coming from Mexico and whatever. Like, make sure you wash those off properly. Okay? And salad, ladies. Salad. E. coli. Right? Your lettuce. Give you a lot of parasites. Now, look, if you have a good stomach acidity, that's one of the things it kills right there and then. Parasites. Okay? Your stomach is a furnace. It's meant to kill yeast, and it's meant to kill parasites. It doesn't want to let it down into your bowel. The big problem is because of a lack of acidity and not enough enzymes, and you're not killing those bad guys, parasites. So you might want to do a candida parasite cleanse. I like that too. temporarily. Make sure you get rid of parasites. Okay? Regenerate your gut. Well, you know what I love about bone broth? People ask me, why do you love bone broth so much, Dr. Martin? Well, because it's a regenerator. It's a regenerator. It regenerates the gut. You can live on bone broth for a while. You got a real, look, this is one that I tell my patients, okay? I talked to a patient yesterday on the phone, and I said to her, listen to me, her gut is angry, okay? And I'm not even seen her, but I already knew what she had. I said, listen, here's what you got. You got diverticulosis. How do you know that, Dr. Martin? Because I've been around for 46 years, as it was in the days of Noah, okay? I've seen thousands, tens of thousands, 20,000s of digestive issues over the years. And you just listen. Where do you have your pain? Oh, it's on the left side. I said, I'm going to tell you something. You have diverticulosis. So quit eating salad, okay? Quit eating salad and live on, and now it's very angry. So it's gone from diverticulosis to diverticulitis. What's the difference? Pain is the difference. You got lots of pain? I said, your gut is angry. When your gut is angry, stop eating, okay? When it's angry, stop eating. It's amazing what happens, okay? It's like having a gallbladder attack. You know what I tell people? Like, stop eating for a couple of days. Like, just live on some bone broth. And the reason I like bone broth is because you got everything in it. And one of the things in bone broth is L-glutamine. L-glutamine regenerates the gut. And that's why I tell people I love it. And you can have it on the reset. You can make Dr. Martin's Perfect Smoothie on the reset with bone broth. That can be a meal replacement. It can be 2 meals replacement. It can be 3 meal replacement. For a couple of days, for people, I say, well, your gut is angry. You might not eat for the next 3 or 4 days. Just have some water and bone broth, okay? It settles the gut right down. It takes that angriness out of the gut. So that's very important, okay? So I like that. So probiotics, digestive enzymes, bone broth, okay? Maybe do a candida cleanse if you need it. If you got yeast or parasites, do a cleanse. And don't feed the bears. Parasites want to be fed. Yeast wants to be fed. And don't feed them any sugar. None. Zero. Nada. Stop eating sugar and your gut gets a lot better. It's amazing. Amazing. Okay? And I see how I get on the rabbit trail and I forgot. You know what? When you are on the reset, one of the reasons your gut, like I talked to you about no fiber, but I didn't talk to you about you're not going to have any lectins. You're not going to have any oxalates, okay? No lectins, no gluten. I'm not necessarily that big on gluten schmooten, okay? Because I don't think the problem is gluten as much as it's insulin. But anyways, okay, unless you're celiac. But when you're on the reset, you're eating none of those things. Lectins, and they're not always bad for you. I don't believe that all lectins are bad. Nah, they're not. But they're full of fibers, and they can irritate the gut. And oxalates, they can give you kidney stone and gallstones. Oxalates. How do you get oxalates? Vegetables. You vegetarians out there? I'm not your best friend, eh? I know. Anyway, I love you guys anyways, okay? So those are the things that I recommend for IBS. So time's up. Love you guys. Talk to you soon.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.